Coronavirus is continuing to take lives in London. So today we're asking, who is being most affected? There's a growing suggestion that Londoners from Black, Asian and minority ethnic backgrounds may be disproportionately affected by COVID-19. It's become a pressing issue for the government and a deeply personal one for those who have lost loved ones. One thing we do know is that many of those who have died are key workers. Tolu Odoyo reports.
The heart of London. Quiet over the last few weeks as many families across the city have grieved behind closed doors. Thousands of people have now died in London with COVID-19. Among them, essential workers, including healthcare and transport staff, who carried on going out to work while the city locked down. Mally Kennedy worked as a bus driver in Croydon.
Big wheel, keep on turning to the proud and we keep on rolling.
The father of three brought up his daughters alone following his wife's death from pneumonia 16 years ago.
He's the type of man that would send us all sort of daily texts about where he is, what he's doing, what he's eating. He'd take a picture of his calf meal in the morning before he went to work and always send us a kiss and say, have a good day. And he's the type of grandfather that would visit and give each child £20 for no good reason. The children always used to get excited when they heard he was coming around. They used to call him Poppy.
Mally died on the 4th of April. Penny, who's a nurse, believes PPE may have made a difference. At the moment, it's not recommended for workers in non-care settings.
My dad was very much at risk. Being a senior driver as well, being 67, at that point furlough hadn't even come into play, so he was never offered time off work. He had to go to work, he lived hand to mouth. He had to provide for himself and for his family.
From nurses to doctors, care assistants and porters, around 50 NHS and care workers are believed to have died in London with COVID-19. Sisters Esther and Mary lived together and also worked together as healthcare assistants at Queen Elizabeth Hospital in Woolwich. They were taken ill within hours of each other. Esther died 2 weeks ago. Her sister is still being treated in hospital.
She's she was someone who would go far and beyond just to help someone for something as little, and she's just all about enjoying life and helping people to the best of her abilities.
Samuel's mum worked right up until she was admitted to hospital, despite having an underlying kidney condition.
When they came home, they didn't show any signs of or fear of, they got on with it. They just went to work because their character are strong people.
Samuel has a young son and will now also care for his 14-year-old sister. Behind every face, there's a family, friends, colleagues. Many of them do have questions. Did anything make my loved one more vulnerable? Could anything have made a difference?
NHS staff and carers are working to tackle the virus and keep patients alive. We spoke to A&E doctor Javid Abdelmoneem, who believes those from a minority ethnic background are more at risk.
Hi, can you put out a multiple trauma call to A&E Resus now, please?
I'm part of a legacy of BAME workers who have helped create and sustain the NHS for over 70 years.
These 6 young ladies are from Pakistan, and they're student nurses at London's Mile End Hospital.
Since its inception, tens of thousands of us have devoted our careers to the NHS and have been proud to do so despite enduring racial inequalities within the organisation. I fear what seems to be the excessive death toll amongst BAME staff during this pandemic may yet be another sign of that injustice. Osman, a doctor at Northwick Park Hospital, has recently recovered from the coronavirus. He contracted the disease at the same time as his father. Dr. Adil El-Tayr didn't survive.
There was a part of me that thought, no, he's not quite unwell enough for this to be fatal. We were getting daily updates from the hospital, but again, I didn't imagine that it would be so sudden
Osman fears his father may not have been properly protected and worries about a continuing shortage of safety gear in the NHS.
Everyone who's going into work knows that they're essentially putting themselves at risk of picking it up, but the fact that we've had any deaths to frontline staff in the first place was too much.
Why we have a higher death compared to non-ethnic background is because we're on the front line. So right now, where I'm working, everybody is from an ethnic background.
Margaret Barron has worked for the NHS for 2 decades and says things have never been bleaker than now. Recently, a colleague and friend of hers died after contracting COVID-19.
Food lovely. Roast beef.
I worked with him for 17 years on a rehab unit. He was lad's lad, so cheeky Tom. He attended his patients, he gave them 100%.
Of course, they don't know that.
Goodmayes Hospital says there were no symptomatic patients on the ward where NHS healthcare assistant Thomas Harvey worked. But his former co-worker, Margaret, believes he might still be around if he had been provided with the right protective gear.
I remember myself calling Thomas and asking him if he had a face mask I could have. And he said that they didn't have any PPEs, they didn't even have the basic face mask.
The scarcity of PPE is particularly worrying for ethnic minority staff because these communities are known to have a higher prevalence of medical conditions which increase the likelihood of suffering severe COVID-19 illness. These health outcomes can be the result of socio-economic factors, and there is concern that the recently announced government inquiry won't address this.
I'm glad that the government is looking into this, but I don't want this to be a report which goes on the shelf, right, and we'll be looking at it. I think what the pandemic has shown has been the inequalities have been exposed. And people who are really dying are the ones who are the front line, who are low-paid jobs, as I said, and majority of them represented by the BME community.
I believe the NHS has an increased duty of care towards vulnerable BAME staff who might be exposed to the virus through their work. And if the government inquiry into the excess death toll amongst the BAME community finds that that duty of care wasn't exercised, it would be a failure of those in charge to protect their staff.
So what does the data say at the moment? Non-white people account for 40% of the population, but 44% of deaths. White people make up 59% of the population and account for 55% of deaths. So why might this have happened?
I think there are two broad headings as to why this could be happening. One, are people from black and Asian ethnic minority backgrounds more exposed to the virus? Are they in jobs which put them at greater risk? The other is, of course, are there characteristics that, should they get infected, give rise to a more serious infection and greater risk of death? In a crisis like this, pre-existing inequalities will be heightened. People from ethnic minority backgrounds are living in overcrowding at a much higher rate than the white population. The public health messaging that has come out to help people understand how to protect themselves from infection, those have not been necessarily culturally tailored. We need to put in place measures now to protect our black and ethnic minority community, but also in particular our health and social care workers who have to be in contact with the virus as they go into work looking after patients.
But it's not just frontline staff. How much does where you live and what you do affect rates of infection? Here's Tara Welsh.
"7 a.m. in Harlesden. London is still in lockdown. But here, social distancing can be difficult. Brent is one of the worst affected areas in the UK. At bus stop X, we meet Marva as she travels to work as a carer.
I'm not really feeling good about it, but I don't have no other else option. People depend on us. They're looking forward to see us in the morning. We still have bills to pay and everything. I have to work.
Most people we speak to are key workers.
I'm going home, just finished shift. I work for the NHS, mental health department, and we've got people in there that we need to look after. Yeah.
I have to work, so I try to feel like it's normal, but it's not normal.
How worried are you?
A little bit, but I try avoid it. I don't think about it. My bus is coming, so it's okay.
Helena leaves to get on the 266 bus to her cleaning job. It's really hard seeing how many people getting onto a bus because you kind of feel for the driver, you feel for everyone on it, but what are people meant to do if they've got to go to work? 3 miles away in Wembley, we meet Veronica. She's recovered from COVID-19, but now she's lost her job.
I was freelance, so I was told that, I have just a week's notice. So I've been waiting for my agency, the umbrella, I used to work for under umbrella company, to kind of know if I can get furloughed by them, but I haven't heard from them. It's been a couple of weeks now.
This is one of the most deprived parts of the country, and now it's got one of the highest death rates. By mid-April, 286 people with COVID-19 had died here.
People are scared. People don't know what has hit us. And the black and the minority community, we are in the front line.
More than 2/3 of people living in Brent are non-white.
It's very distressing when you know that the outcomes are worse for black people and for Asian people, and people understand that, the last time they might see a relative is the time that they're being driven away in an ambulance, and not being able to see them again. It is very distressing. I've lost my uncle to COVID, so it's also sort of very personal, and you just think that a lot more needs to be done. And I think what COVID has done, it really has shone a spotlight in why we really have to address the inequalities in society.
10 miles away, south of the river, things look very different. So we're right in the centre of Kingston and it's so quiet. I've never seen it like this before. Kingston is relatively affluent and wages are higher. By mid-April, 54 people had died here, a huge loss, but the lowest number in the whole of London. The death rate in Brent is almost 3 times higher.
Open spaces, people can get out and fresh air, and it's we're not crammed in with lots of high rises and things like that, so perhaps people are a bit more socially distanced normally than in some parts of the capital anyway.
There are so many variables, it's really hard to know anything for certain, but it seems obvious if streets are emptier, there's fewer people getting on buses, more people working from home, then it makes sense that infection rates would be lower in areas like Kingston.
People who live in deprived areas have much shorter life expectancy than people who live in less deprived areas. The lockdown will exaggerate social and economic inequalities, no question. That means it's likely to increase health inequalities.
It's been said that the virus doesn't discriminate, but it may be that COVID-19 highlights the capital's inequalities that have always existed.
More than 250 languages are spoken in London, and there have been concerns about whether public health information is reaching people who don't speak English. Aisha Baksh reports on the people translating it.
Olá. Em espaço de tempo muito curto,
En peu de temps, notre vie quotidienne a radicalement changé.
大家好，在最近一段时间里
Advice on how to stay safe in some of the many languages spoken in London. These translations of coronavirus guidance were all done by volunteers and organised by a project manager from Ilford in her spare time.
I just thought that there wasn't much resource in terms of language translations for the guidelines for ethnic minorities, and especially with all the talk about ethnic minorities being affected at a disproportional rate for COVID-19, I thought this could be a way to help. and really get that message into those communities.
Public Health England have translated the COVID-19 advice into different languages for leaflets, but community centres are closed and not everyone is on the internet or social media. For over 30 years, Ramesh Verma has been working with elderly South Asians in Newham. Now they are housebound, alone and afraid, but she makes sure the connection is still there.
I ring them every other day and try to find out what are their needs, how are they feeling, how is their health, and is there anything they need, example food, medication, or they just want to have a chat and give them a little bit of confidence and ask them to keep it up, it'll be over soon.
In Greenwich, the Nepalese community is mainly British Army Gurkha veterans, many of whom are illiterate and live in poverty. And several have already sadly passed away. Local volunteers are supporting them with supplies and important advice.
We are Gurkha, we're used to the hardship and we are armed forces, so we'll fight for this. So that keeps us going as well. They are so positive. Some are struggling, but they always have a smile on their face. It's like they really appreciate whatever little things everybody's doing.
So while the message of staying safe is reaching out to diverse communities, trusted grassroots connections are also speaking volumes to those most in need.
The situation and the data is constantly changing, so this is only what we know so far. A government review into the issue is currently underway, and Public Health England say that detailed and careful work is being done before they draw any conclusions.